Over the last 24 hours, we identified 238 new cases of COVID-19 and completed about 5,400 tests. Our positivity rate is 4.5%. There are currently 434 people being treated for COVID-19 in hospital, including 81 in the ICU. Sadly, I must announce that 6 new deaths have been reported to Alberta Health in the last 24 hours. I extend my deepest sympathies to anyone who is grieving a loss from any cause. As mentioned yesterday, my team and I are closely monitoring new developments around the Omicron variant. And as we committed, we will continue to keep Albertans updated with any new developments. This is why today, in the interest of transparency, I'm reporting that we have now 1 confirmed case of the Omicron variant in Alberta. This case has been confirmed in a returning traveller from Nigeria and the Netherlands. The individual tested positive while asymptomatic, and I can confirm that this individual has not left quarantine since their arrival from international travel. We have notified the individual and their household, and all necessary measures are in place to prevent transmission. I would like to remind all Albertans that neither this individual nor their household members have done anything wrong. From previous variants and spread, we have at times seen stigma or criticism directed towards individuals or groups. I encourage all Albertans to show empathy to this household and any others who may eventually be identified with the Omicron variant. While it is important that we all continue to be vigilant in the face of COVID-19 to protect ourselves and others, I don't want Albertans to be alarmed. As I mentioned yesterday, we anticipated the arrival of this variant in the province eventually, based on what we have seen with previous strains of COVID-19. We are well prepared for this eventuality and have the necessary tools in place to monitor this case and any potential spread of the variant. As I have mentioned, our goal is to delay the spread of Omicron while we learn more about it. At this time, this is the only confirmed case of Omicron in the province. There are federal requirements currently in place, including a mandate that anyone who has arrived in Canada from South Africa, Eswatini, Lesotho, Botswana, Zimbabwe, Mozambique, and Namibia in the last 14 days is required to immediately have a COVID test and to quarantine at home for 14 days following their arrival. All of these travelers already in Alberta were contacted over the weekend with information on current protocols, including testing and quarantine requirements. These travelers and their households have also been offered household rapid testing kits in addition to PCR testing requirements. Going forward, any Canadian citizens or permanent residents who return after the travel ban must get a molecular test in their connecting country and then an arrival test upon landing in Canada. Per the federal requirements, while awaiting test results, they will be required to stay at a designated hotel. If the test is negative, they can leave the hotel, but will face a mandatory 14-day quarantine at home and testing again on day 8 after returning. We will continue to monitor any new advice coming from the federal government and adjust our approach as needed. I also want to emphasize that we should not stigmatize countries where new variants are identified, as these are simply the countries where we know about transmission. For this reason, when we identify a case in a returning international traveller from any country, we will do a full case investigation, contact tracing and notification, offer PCR testing for all close contacts, and make rapid testing available for households and in some specific settings such as schools and childcare. With the emergence of this new variant, I want to remind Albertans of the steps they can take to help prevent the spread of COVID-19. These steps have worked before, and we anticipate they will continue to work with this new variant. First and foremost, having a complete vaccine series is the best defense we have against COVID-19. If you haven't already, please take the necessary steps to be immunized. There continue to be vaccines available across the province, and the majority of Albertans aged 12 and up who haven't received a vaccine yet could do so on a walk-in basis as early as today. Vaccines are also now available by appointment for children aged 5 to 11. I encourage parents and guardians to seek out reliable information when making vaccine decisions for their children. Registration for tonight's Teletown Hall on this topic is now closed, but we will post the audio online afterwards for Albertans who were unable to participate but who would like to hear the conversation. And as always, whether you are vaccinated or not, please continue to follow all public health measures currently in place. They have been well proven to reduce spread of COVID-19, and at this time there are no signals that they will be less effective against Omicron. Maintain good hand hygiene, wear a mask in all indoor public places, keep your gatherings small and outdoors if possible, avoid crowded indoor places, and maintain 2 meters of physical distancing at all times when interacting with people outside your household. If we all follow the measures in place, and as many of us as possible are fully vaccinated, we can protect our communities and our healthcare system by controlling the spread of Omicron and other variants. Thank you, and I'm happy to take questions.
Thank you, Dr. Hinshaw. We have one reporter here in the room and reporters on the phone. So we'll start here in the room. If you could state your name and outlet, and you can begin.
Hi, Dr. Hinshaw. Anna Yonker from the Edmonton Journal and Sun. First of all, I was hoping you could just go over what we actually know at this time about the Omicron variant.
Thank you. Great question. So what we know about the Omicron variant is that it has a large number of mutations. So most of what we know is really based on the genetic sequencing, where we look at all of the genes in this particular variant. We know that there are a large number of mutations present on the spike protein, which is the protein that is typically the target of neutralizing antibodies that are generated both after an infection and also after someone receives the vaccine. We know that there are a few mutations in other parts of the genetic sequence as well, and so we're still learning how that might impact the behavior of this virus. In places where it has been identified in the highest numbers, and really those are the only places where we would have indication about the behavior of this particular virus. So far, the cases have been mostly mild, although they've also been identified mostly in younger people. So it's difficult to determine whether or not there's any difference in outcomes with this variant. There seems to potentially be a bit of a higher risk of reinfection when someone's previously been infected. This variant, again, it's very early days, but there is this early indication that possibly there may be a higher risk of reinfection post-previous infection. We don't know yet whether or not vaccine effectiveness will be impacted by this variant. It's too early to tell. We do know that for all of our previous variants, even when there's been some impact in protection against infection from vaccine, there's consistently been very strong protection against severe outcomes with every new variant we've previously had. So again, having a full vaccine series is still the best choice, even when it comes to this new variant, as we continue to learn more about it.
Do you have a follow-up?
Yeah, what is currently being recommended for asymptomatic close contacts of confirmed cases of the variant, of this new variant?
I just want to go through a little bit about the process of how we would identify the variant. So in Alberta, of course, we do PCR testing for confirming cases. All of our new cases have a screen done, which is a quicker process that can identify known mutations for previous variants. And so that screen will tell us, is this a case that has a Delta mutation? If so, then that's, again, something that we already know. We have a lot of that. In the past week, for example, we know that 99.8% of all of our new cases in Alberta were the Delta variant. It continues to be our dominant variant. For all of those cases that don't screen positive for Delta, there will be whole genome sequencing done, which means that we're looking at all of the different genes in the sequence of that particular sample. And so it does take a little bit of time between when we identify a case on PCR testing, and then it can take 1 to 2 weeks before we move through all of those processes to determine an Omicron variant that is confirmed. That's why in the meantime, we are taking an approach based on a history of recent international travel, so that someone who is a close contact of a confirmed case with a recent history of international travel from any country that we are doing additional close contact tracing, notification, offering PCR testing even to those who are asymptomatic of that particular group. Again, this is close contacts of someone who's recently traveled internationally from any country. And those individuals would be contacted by AHS to notify them of this exposure and then to offer PCR testing. When we do have a confirmed Omicron variant, we will also then make sure we're going back and ensuring that the individual knows in the short term, as long as this is a very rare type of variant, we will be informing individuals that this variant has been identified. And if it's someone who hadn't traveled internationally, it would typically mean that their case had been followed up initially a week or two prior. So we would do a retrospective case investigation at that point for any new confirmed cases of Omicron. And again, do that contact tracing, ensuring that people have the ability to go and get tested. If anyone develops symptoms in the 14 days after they were exposed, they would be considered a probable case, and additional contact tracing would be done. So that's the process right now, again, for cases in international travelers, as well as the confirmed Omicron cases, which we would identify a little bit after their initial positive test.
We'll move to the phones now. Operator, can you put through the first caller, please?
Mirna Jusic, CBC.
Hi, Dr. Hinshaw. Thank you for taking my question. In light of this new variant, what will determine if, the restrictions need to be tightened in Alberta or not?
The single case that we have really doesn't change our current risk. Again, we know that the vast majority of all of our cases in Alberta continue to be the Delta variant. We know that the measures that we currently have in place have been effective at slowing spread. And the more that we can increase our immunization rates, the better off we'll be, not just for our current Delta dominant cases, but any eventuality of potentially seeing Omicron in the weeks ahead. So as we're looking at our current public health measures and assessing what the right balance is, again, we need to take into account everything that we do know about COVID in general and also about this new variant. So as I mentioned, we are being cautious in the short term, enhancing a targeted contact tracing and additional testing in close contacts of international travel cases in order to minimize the chance of transmission and slow that down while we learn more about this variant.
Myrna, do you have a follow-up?
Yeah, short one. You mentioned that this person has not left quarantine since they arrived in the country. Could you just let us know when they arrived? How long was it before the moment they arrived and when you detected the variant?
My understanding is that arrival was about a week ago and that the initial test was taken on arrival. And then, of course, as I mentioned, there is a time lag between when the initial positive is identified and then when the follow-up testing can be done. So again, it was approximately 1 week ago that the test was taken.
Operator, please put through the next caller.
Dan Grummett, Global News.
Yes, Dr. Hinshaw. Can you just tell me, where is this case residing? I mean, which airport did this person return to? And can you tell us where this infected individual is residing, and were they traveling alone or with other family members?
We're not releasing location because, again, this individual has been under strict quarantine, and so therefore the location where they live is something that could potentially be identifiable. And there's no increased local risk in that area. So we are really focused again on disclosing the information to the public about this identified case without jeopardizing confidentiality. And so the information about location is not something that we're able to share. With respect to the travel circumstances, it's my understanding this individual traveled alone. And that, again, all measures are being taken to limit any potential for onward transmission.
Dan, do you have a follow-up?
Yeah, I'm just curious, like when you're monitoring Omicron, you're obviously getting, you're checking with the feds to see what they're looking at, but you always look at foreign countries as well. What country are you most looking at right now? I mean, we heard today there's early evidence that Omicron was detected 5 days before South Africa sounded the alarm on November 19th. So when you're trying to figure out the variant, what country are you most looking at to help follow the evidence?
I want to emphasize that the countries where we have the most information aren't necessarily the countries with the highest risk because, of course, testing protocols, testing structures vary from country to country. And so that's why once we have seen a particular variant of concern emerge in any country around the world, we've seen time and time again that at the point in time where we know that it's a variant of concern is because it's copied itself through passing to enough people that we know about that spread. And at that point in time, it will have already passed on to other countries around the world. So again, it's important, and that's why here what we're doing is really focusing on a generic approach. So anyone who's come back from a country outside of Canada in the last 14 days, if they're diagnosed with COVID, that we will be doing this additional targeted follow-up because it's very difficult to know as a new variant emerges where it potentially could have already spread. So we are taking this cautious approach at this time.
Operator, please put through the next caller.
David Staples, Edmonton Journal.
Thanks for taking my call, Dr. Hinshaw. You're saying today that Albertans should not be alarmed, and you're the WHO, both you and the WHO are reporting that not much yet is known if this is more transmissible or if it's more able to evade vaccines and more lethal. But the WHO also says in its statement, and I'm going to quote, the overall global risk related to the new VOC Omicron is assessed as very high. And that seems to be kind of an alarming statement to me. And I'm wondering what you make of the WHO statement and whether that very high risk is relevant to Alberta or more to other places.
It's my understanding that the risk assessment is really based on the fact that this particular virus has a higher number of mutations in significant locations of the virus than we've seen prior, and so there is that possibility, there's that question about what that might mean for vaccine protection, again, how it might interact with people who've previously been infected with a different variant. So there are a lot of questions. I personally think that one of the main reasons why something, a new virus that has a lot of mutations, that early indications are that it may be more transmissible than Delta. Again, there's lots of questions about that, but it's a possibility. Anything that can spread more widely is clearly a concern, particularly in countries where vaccine coverage is low. And while we need to watch very closely to determine whether or not this virus behaves differently against vaccines, certainly there are many, many countries around the world where they have not had either the supply or the ability to expand coverage. And so globally, as long as there are countries where the virus could transmit widely, if it enters those countries, we are all at risk. And so part of this risk, I think, is about vaccine equity around the world. Part of the risk is about some of those unknowns, and until we know more about the virus as we are learning about it, I think it's appropriate to have that high level of caution. But the reason I want to reassure Albertans in particular, I do believe that based on everything we've seen prior, that vaccines are likely to provide still some protection against severe outcomes. And I believe we have a very good infrastructure for being able to detect this in its early days and slow its spread. We know that there are oral antivirals being developed, so medications that can help mitigate the risk of severe outcomes. We have the ability to offer vaccines to younger groups right now. There's lots of reasons to be hopeful. And so I think it's important that we're cautious, but that we also not see this as a reset to ground zero.
David, do you have a follow-up?
Yes. Dr. Hinshaw, Premier Kenney talked about perhaps loosening some restrictions around groups around Christmas time. And, the initial consensus was once there was around 70% vaccination rate, we would start to get to endemic phase, and that's what we based our Alberta based policy on this summer. We're now close to 90% first dose vaccination. So does it make sense now to loosen up some of these restrictions and give people more freedom to meet with each other in the Christmas season here?
It's important to distinguish between the almost 90% of those who are 12 and older who have at least one dose and the total population coverage, which is about 10% lower. We know that younger Albertans are less likely to have severe outcomes, but they can still get infected and they can still spread the virus to others. So, of course, it's great news that we have this vaccine available for those who are 5 to 11. I'm thrilled that my own kids are able to get that vaccine, and we have that ability to provide enhanced population protection with this particular product. We don't know, though, what is that number that will give us the ability to ease all of our restrictions. I think as we approach the holiday season, we know there are many different types of holidays over the next month where people want to spend time with family and friends. I think we need to look at a balance again. We need to minimize the direct harms from COVID. We also need to minimize the harms of the restrictions. And so that's the continual conversation, is what is that right balance? And as we've seen our cases come down, what is that right timing and how do we mitigate the risk? Because there is still a risk that we could see widening spread and impacts on our healthcare system. So we need to continue to work on that balance.
Operator, please put through the next caller.
7 Minutes, CTV.
Hi, Dr. Hinshaw. I wanted to follow up on Mr. Staples' question just now. Premier Kenney said that his government was considering relaxing indoor gathering restrictions for the holidays. In your opinion, based on what we know right now, is that a good idea?
I think it depends on the exact way that restrictions might be eased, as well as whether or not there are additional protective measures that we can put in place to mitigate any increased risk of transmission. We know that the public health restrictions that are currently in place have impacts, and we know that social isolation is a significant problem. So as we look at all of our current measures, as we look at whether or not there are additional protective layers that we might be able to bring in over the coming weeks, I think that it's that balance that will determine what the right next step would be, and those are the discussions that are underway at this time.
Kevin, do you have a follow-up?
I do. You gave the same answer you just gave to David. So I guess I'm wondering then, what are the options on the menu that you're looking at? You're talking about specificity around what restrictions could be lifted. So what are these options?
Well, ultimately, I don't think it's the right time to completely lift all of our indoor social gathering restrictions. So whether or not there's an easing, I don't think this is the time to turn them all off. So it's a matter of perhaps allowing an increase in numbers. Again, whether or not there are other things that we could potentially introduce in terms of protective layers. You've, heard some conversations about whether or not at some point in the next week or so we might be contemplating expansion of booster eligibility. So I think, again, we need to be looking at what are the things that we have that are available to us in population protection, and then how can we potentially safely ease off restrictions without enhancing the risk too significantly.
We have time for one more question. Operator, can you put through the last caller for the day?
Lauren Pullen, Global.
Hi, Dr. Hinshaw. Thanks for taking my question this afternoon. Premier Kenney said yesterday that 156 travelers have returned from countries of concern. Is there any updated number today on that? And can you tell me how many of those travelers have completed that full screening to know that this is the only one case that has resulted from that?
The number 156 is the number that had arrived in the 14 days prior to the implementation of the border measures that were put into place on Friday. So I don't have an updated number in terms of the travelers who might have arrived after those measures were put in place. We'd have to follow up offline to be able to provide you with an assessment of how many have completed their tests. That's not a number I have at hand. I can tell you that each of those travelers is receiving a phone call individually from the Public Health Agency of Canada, and they've also received information from Alberta Health in terms of the requirements as well as the option of at-home testing kits. So they have received follow-up from various sources, and we can follow up offline to see where our most recent numbers are at in terms of the number that have gone and gotten that follow-up PCR test.
Lauren, do you have a follow-up?
I do, thank you. I just wanted to touch base with the arrival of Omicron and it being kind of similar to the way that things rolled out with B.1.1.7, the Alpha variant. Of course, we know with Delta, the open for summer plan dropped almost basically all restrictions. With Alpha, there were still some in place. But what have we learned from that rollout? Because that variant still did spread out of control across Alberta. So what more is being done to ensure that that same scenario doesn't roll out again, anything above and beyond?
As people might recall, we had our first Alpha case right around Christmas last year, and we did employ aggressive targeted measures to delay the spread of that particular variant. As we sequentially eased measures, as our second wave declined in the early part of this year, we saw, again, our second wave was predominantly what we call wild type, or the previous strain of COVID. And as we saw those measures ease, we saw an increase in Alpha. And as you know, Alpha was the predominant type of our third wave in the spring. It's clear that we need to be cautious at this point in time. We have seasonality factors, so people spending more time inside, colder weather, some of those factors that can increase risk of transmission just purely from a seasonal perspective. But we have advantages as well. We have a much more highly immunized population. Obviously, when Alpha arrived, we were only beginning the rollout of our vaccine program. So again, I think we can learn the lessons of caution. And again, that's exactly what we're doing in terms of looking very, very closely at the balance of all of those factors as we contemplate what that right suite of measures is to minimize the impacts from COVID, minimize the impacts, the negative impacts of the interventions. I also think we need to continually take into account our evolving context. And again, vaccines are an important intervention, and they're a big part of why right now we're able to have a lot more activities happening with proof of vaccination than we were able to have last year at this time. So again, the basic lessons really are for everyone that we need to follow the measures that are in place, and that anyone who's eligible, a full course of vaccine is an additional assistance in protecting our communities, protecting our healthcare system from the negative impacts of COVID, and allowing us to continue to have the opportunity to have more interactions and activities in a safe way.
Thank you, everyone. That concludes today's media availability with Dr. Tina Hinshaw, Chief Medical Officer of Health. Have a good afternoon, everyone.